How's it going, everyone? This is Travis Estes here. Another walk and talk. Again, it's happening at night. I'm such a busy guy lately. I feel like during the day, I'm pretty much just slammed. Anyways, it's Tuesday evening now. Since last Tuesday evening, I have been sick as a dog. I thought I was getting strep throat. Went to work on Wednesday. I didn't think it was strep yet. I just had a sore throat. My glands were a little swollen. And by the end of the work day, I was just totally laid up and didn't go to work on Wednesday, Thursday, Friday, Monday, and now Tuesday. Ended up going to the hospital over the weekend. Turned out I had a viral infection of my lymph system. It had swollen up my throat so much I couldn't talk. It was pressing on my vocal cords. Breathing was difficult. It was absolutely horrible. I couldn't swallow. I just lied on the couch and tried to drink water and get through it, and it pretty much sucked. So, I was trying to explain to my wife how much this sucked. I wasn't just being a baby. I was really sick before we finally went to the hospital and got this diagnosis that I'm finally now getting over. And it made me think back to, I was trying to explain to her, have you seen me really sick before? This is the sickest I've been in a long time. And the truth is, she has never really seen me that sick before. I'm typically a pretty healthy guy, though I've been pretty sick a few times in my life. So I thought I'd tell a little story about the sickest I've ever been, kind of my countdown of examples. So I'm sure some of you guys have been sick before, and maybe some of you guys are, maybe have, congenital or chronic illnesses, so you guys have me beat. But for me, these things all sucked. So going back to the earliest time I was really sick, when I was in 4th grade, maybe it was 5th grade, I got chicken pox. A little bit old for getting chicken pox. Anyways, I ended up having it for about 2.5, 3 weeks. Pretty bad. I had it for a long time. I had the blisters all over my body, thousands of them. I'm surprised I'm not covered in scars. Maybe just my pasty white skin hides them pretty well, but or just they're blended in with all the moles I got. But yeah, that was pretty bad. So that was the first time I was really, really sick that I remember being like, this is bullshit. I don't like being sick. But anyways, I didn't really get sick too much besides that. Strep throat a few times, a couple times getting the flu, until maybe when I was 22, I got a really bad case of the flu. I was poor at the time and didn't really have health insurance, and I didn't get the flu shot, and I ended up getting the flu, and I got an ear infection in both ears at the same time. Garbage. I spent about 6 days in one spot with hot compresses to each ear, drinking dangerous amounts of Theraflu. I probably should have gone to the doctor and got some, prescription cough syrup or ear drops, but I didn't want to go rack up debt for something I thought I could get through. Travis today would have gone to the hospital, but I stuck through it. So those are the first 2 in my early life. The next 3, though, these are ones where I was so sick that I've told doctors about this since, and the little bastards would be like, oh, well, you clearly didn't have that. You would have died. And it's like, I did have that, and I can tell you exactly why I did. So I was living in San Diego, pretty healthy guy, like I said, normally. On the way to work, me and my buddy Daryl and Leon, we go grab some breakfast burritos. We eat the breakfast burritos. We're at work. All of a sudden, I start not feeling so well. I'm thinking it's this burrito I ate, right? But my 2 roommates had the same burritos. They're not getting sick, and I'm feeling pretty bad. So I go home. Anyways, I go home. I start puking, diarrhea. Sorry for the details. It's bad. There's this bad things coming out of every part of my body, and it's horrible, and it doesn't stop. I can't eat. I can't drink. Literally, I'll drink a glass of water, I will throw it up immediately. I try to eat some food, I'll throw it up immediately. So now I'm just having cramps, wanting to go to the bathroom, can't, there's nothing left. Trying to puke, there's nothing left. And so I'm just filling up a glass of water in the bathroom, chugging it because I know I need water, but immediately throwing it up. That lasted for about 5-6 days. Again, I took nothing but over-the-counters. It was a great company I worked at. I made good money, but they didn't have health insurance, and in my whole life, I've kind of been just, I'll get through it myself. Why spend thousands of dollars on a doctor when my body will fix itself? So anyways, after about a week of this, I lost like 12, 13 pounds. Like, it's kind of crazy how much weight I lost. So I lost all this weight, finally started feeling better. It was all good. So fast forward a couple of years, I'm at my brother's wedding. I'm the best man at Tyler's wedding. I give this great speech. We're playing these games. I chug a couple beers. These were super light wedding beers, like they didn't really have any alcohol in them. I was not drunk. Not that there's nothing wrong with being drunk, just in this instance, I was not drunk. And all of a sudden, my stomach started hurting, and I'm at this wedding reception, which in Germany, they go from dawn to dusk. I mean, the wedding was at sunrise, and we're now moving into like evening time of this celebration. And I'm out in the kind of lobby area of this facility where we're doing the reception, and I'm, my stomach's bloating up and swelling, unbutton my belt, I'm puking, the same type of things, right? Luckily, Tyler's father-in-law, he's an OBGYN, he's a doctor. He had this little Felix, magic bag kit of shots, and I was like, hey, I'm sick. I'm not drunk. I'm sick. And he took me back to the house. He grabbed his little magic bag, shot me up with antibiotics. He shot me up with he gave me like 5 or 6 shots. I don't even know if that's legal, but whatever. He's in another country. I didn't say his name. God bless you, because he probably saved my life. Turns out, well, I'll get there in a second. So this lasted for, again, about a week. So I'm in Germany for several weeks, and I spent a third of that trip in a bathroom drinking water that I filled up in the sink and immediately puking it out for about a week. Couldn't eat, couldn't hold anything down. Again, lost all the weight I just gained back over, the last year and a half since this happened before. So fast forward a little bit. Now I'm living in Flagstaff. I've moved out of San Diego into Flagstaff, and I'm hanging out with my bros, AJ and Eric, and all of a sudden, oh my gosh, I'm having the same kind of exact pain I had before. So at this point now, this is the third time in a couple years, and I know it's a week of agonizing, just complete, garbage, pain, cramping, diarrhea, vomiting, just like literally like on the bathroom floor, convulsing and sobbing because you want it to end. It's horrible. So I go to the ER. We get to the ER, and I'm having stomach pains and I'm nauseous, and apparently they were having a rowdy night. It was like a Friday or something, and they're like, okay, well, sit in the lobby. So I sit for about 2 hours, and at this point I'm getting pretty bad. And this is the thing, I'm a really tough guy. I have a really high tolerance for pain and bullshit in general. So when I start like complaining, it usually means that shit is really going down now. So I didn't want to look like a little bitch in front of my youngest brother AJ, so I told him, I was like, hey bro, I'm about to make a scene and get admitted, so don't hold it against me. And he's like, what do you mean? And so I immediately, I flail on the ground, I yell, dry heave, throw up a little bit, start convulsing, just make a goddamn scene in this lobby. Immediately they take me back. And then once I get back into the hospital, start seeing what all the holdup is, right? They've got just, 7 or 8 of these, Flagstaff transient types that are just drunk as a skunk, handcuffed to their stretchers, spitting and cursing at nurses and doctors, just making everyone's life hell, right? So they're dealing with all these assholes that have alcohol poisoning and are just being overall dicks. So I get in there and I'm rolling back and forth. I'm holding my stomach. I'm still got the show on. And this nurse, this dude, he comes up and I'm like, oh, I'm in pain. I'm freaking dying, man. And I'm rocking back and forth and I'm making a scene of it. But truthfully, it was more like I wasn't making a scene as I just kind of stopped putting on my stoic, I will hold it in togetherness. And he said, he said to me, he's like, well, you know, flailing around is going to make it better. And I was like, well, do you have something that will make it better, asshole? Like, fuck you. I was pretty pissed. Sorry about my language, but I was pretty heated at that moment. So anyways, he gives me a shot of Demerol or something. Instantly start feeling better. So they do some tests. They run my blood. My blood is turning septic. I have appendicitis. I'm like, oh, well, that's what that was. This is my third time having this exact same thing. He says, no, if you had this before, your appendix would have exploded and you would have died. And I was like, well, this is exactly what I had like 2 times before, like just in the last like 3 years. I'm not imagining this. This is exactly what it was before. It's like, well, I've never heard of that happening. So you heard it first. Apparently you can get appendicitis and not die. Or I had something that was so similar, I can't imagine it was anything else. The pain I felt the previous 2 times and this third time, and I didn't even wait till it got bad this third time. I knew what was coming. I'd experienced it before, and I was like, this is going to be a week of me wishing I was dead and feeling like I was dead and literally sobbing on the bathroom floor, wishing I could just hold down a little bit of water and food so I wouldn't get so dehydrated and so run down. So I go in for, you know, basically an emergency appendicitis. I don't know, what do you call it? They took my appendix out, you know? Not so bad. They took it out. I was in the hospital for like 2 days, got out, got better, went back to work. Haven't really had too much problems like that since then. So anyways, this sickness started out this side of my throat, just a little tight. You know, I've had strep a lot of times. Strep sucks, lasts like 3 days. It's garbage, but then you're over it and it's all good, you know? Drink some cough drops and cough syrup and stay hydrated and just relax and you're okay. But this just wasn't happening. It just, my lymph node started swelling and other lymph nodes started swelling, and it was swelling so much that my voice was affected. I was talking like this and I couldn't really say words because it was just pressing against my voice box. You know, I sounded like my Uncle Danny who had MS and couldn't talk that well. You know, that's what my mom said. She's like, man, I wonder if he sounded like you before his voice was affected by that, which makes me wonder. I never heard his voice before he had MS because, you know, that was really before my time. Anyways, yeah, so I'm sitting here sick, and Joanna is, if you know Joanna, you know she's an extremely frugal person. I mean, we have fantastic health care, and I make sure that my health savings account is flush with cash at any time to where I can pay my whole deductible for the whole year at any given time. But, you know, if I don't use it, that money rolls into a retirement account. She's like, oh, you're fine, it's just strep. We don't need to go to the hospital. So like Tuesday, I'm like, I just maybe go. Wednesday, I should go. You know, Friday, I'm like, I need to go. Finally on Saturday, I'm like, I'm going. I need to go. So we go to an urgent care, and they're like, oh, well, we did the test. You don't have strep. You have this lymph node that's inflamed. It's pressing on your vocal box. It's constricting your throat. We're concerned there might be an abscess, but we don't have the equipment to test. Now I'm freaking out, right? Abscess is a big deal. Abscess is an infection inside your body. And an infection inside my body by my throat, the thing I speak with, that, man, this mouth right here, these words I say, this is the moneymaker, man. I'm a communicator. That's how I get stuff done. So I'm freaking out. I'm like, we're going to the hospital right now. So we go to the emergency room. We get in there. You know, I'm totally out of it. They end up coming in. Don't have an abscess, but I have a viral infection of the lymph node system, which at the time they said it was going to take another, 4 days maybe to get out of my system. They gave me a bunch of shots, steroids, antibiotics, and other different things. Gave me like 3 different pills to take 3 times a day and said, rest, drink water, take this, drink this cough syrup with codeine, and you'll be okay. And I was like, well, sweet. So I did that, and I started feeling better. But my Lord, for about 3 days, I felt like I wanted to die. And now I'm kind of like kicking myself, like, why didn't I just put my foot down and say, take my ass to the doctor, I need some treatment? Because if I would have got those shots, and if I would have got that medicine to begin with, I mean, I might have been out of it, 2-3 days earlier than I was. So I was really kind of kicking myself for that. But let me think, is there any other time I've been really, really sick? No, I mean, I've broken arm once, and oh, there was one time. So when I was in 8th grade, I don't know if y'all noticed this crazy little Thai kickboxer nose with 0 cartilage in it. I was on a trampoline, and you know what a double bounce is, where someone kind of jumps right before you and then uses their weight. They pull their feet up and it launches you with all the weight of your weight from the spring plus theirs. Well, someone did that to me at the same time someone got pushed from behind. And so I was like launching, no, I'm sorry, the way they were getting launched up and I was getting pushed opposite of that. I'm sorry. And basically, long story short, their knee went into my face and just crushed this nose, smashed it, just annihilated it. So I had 2 surgeries to make it so I could breathe. I've had no plastic surgery to fix the aesthetics of it, obviously. You know, I'll do that eventually. I got a quote, it's like 12 grand. I'll do it in the next year or 2, now that I finally have some money to do stuff like that. But so I got a surgery on the nose to make it so I could breathe, but they put these huge, gigantic splints. I swear, have you ever seen Total Recall, where they pull that shit out of his nose? Like, when they pulled the splints out of my nose from this surgery, it felt like I was in Total Recall. My nose was stretched out all huge, and this gigantic thing came out, and all this blood and stuff. But the whole time it was in there, every time I swallowed, there was like this weird kind of like one-way valve effect to where pressure built in my sinus, and I couldn't release it. So every time I swallowed, it increased my pain. So for about a week, 2 weeks, I barely drank and I barely ate. Again, lost tons of weight, thought I was gonna die. And the messed up thing is that surgery, it didn't even take, man. I had to go in a second time, and I put it off for about 1.5 years, man. I was scared. That sucked so bad. But it turns out that doctor was really kind of a hack and didn't really know what she was doing. And the second doctor knew what he was doing, but he was limited in what he could do because one was already scar tissue. She took a lot of cartilage out. So he ended up taking some cartilage. You can kind of see this divot here. There's no cartilage there. There's a little triangular cartilage here, and there's none here. There's just bone. So my nose is it's skin with a tiny bit of cartilage. In fact, when I go in to get my nose like fixed to make it shaped normal, they're actually gonna have to take rib cartilage from a cadaver that's been like irradiated and like put it in my nose. And even still, they said they can't build it up to what it should be, but they can make it to where it's, you know, at least not. My nose is gonna slowly do this over time. There's nothing, so it's just gonna flatten. So if I'm an old man, I don't get it fixed, I'll look like this, which is not a good look, you know, so I'm gonna get that fixed. So yeah, that was, I don't know if that counts as being sick, that's like recovering from a surgery, but that also sucked. So yeah, I had the appendicitis thing 3 times. I had the chicken pox when I was really young, and I had this damn lymph node infection of, you know, it took me out for a week. I had to use 32 hours of PTO. 32 hours. 32 hours I could have been in Hawaii or just hanging out, drinking beers, hanging out with friends. Now I'm lying on the couch wishing I was dead. Wishing I could just take a few more sips of water, you know? Because I'm so dehydrated and I just can't do it. Yeah, garbage. Being sick sucks. Someone needs to, like, you know, figure out a cure for that. Being sick is garbage. We don't need that shit in our lives, man. It's nonsense. So, anyways, this story really has no, well, okay. I always say I try to throw a little tidbit of advice at the end of these, or my little lesson learned. Truth is, before I got sick real bad with these lymph nodes, I was not sleeping enough and I was working a little bit too hard. Maybe I was burning the candle at both ends, and I might have compromised my health for that reason. You know, I mean, one time I didn't really get that sick from it, but I've also, because I had chickenpox so late in life, I had it for so long, I'm susceptible to shingles. Eventually, they might make a vaccine for someone my age. One of my doctors was saying I might qualify for it even though I'm older, because I've had shingles twice, and it's always preceded by high stress incidents. The one time I had it before was doing a startup company in Scottsdale with some friends, a mortgage company that was, you know, I was working a lot of hours, it was a lot of pressure, and I ended up getting shingles right across my stomach, which sucked but didn't make me wish I was dead. It just was like an inconvenience. It made me feel a little icky. But yeah, so, you know, take your vitamins, get to bed at a good time, don't work too hard, and take care of yourself. You know, a lot of older folks always say like, hey, you take care of yourself, you know, take care of yourself. And that sounds almost just like a kind of a non-thing, just a thing you say. Like there's no real meaning behind it, but there's some truth in that. Like you got to take care of your body. Like when you're young, your body can take all these hits, right? And you don't feel them, except for you will like later in life. And that's when older people say, take care of yourself. They're saying, you know, be good to your body now because you're going to be living in it for your whole life. You know, however long that is, you're going to live in your body. So, you know, take care of yourself, take care of your vessel, and make sure that you can be as healthy as you can, you know. And that's advice I've got to follow as well. I don't always. Sometimes I just work and work and work and don't stop. So anyways, guys, this is another walk and talk from Travis Estes. Have a good one.